Hi everybody, I'm Rosie and this is Matt, and we are making a film with South East London ICB about the automated registrations success story.
Today, 140 practices in South East London automate their new patient registrations. And the scale of this rollout was only possible because of a year-long pilot led by Lambeth GP Federation. The success of this made the case for South East London ICB to follow.
And, let's be clear, an automation pilot of this size had never been done before and was quite a radical change for practices to embrace.
Definitely from the beginning, I wasn't convinced that automation was going to be successful. A healthy amount of scepticism that this is a product that is actually going to work for primary care. We didn't really have precedent for it.
So, before we get into the detail of the success story, let's define what we mean by automating registrations. How do patients get registered with a GP, and what happens in practices?
Well, in the past, they'd fill out paper forms, drop them off at the practice, and wait to hear back. Since then, the forms have been digitised, but that still leaves a problem for admin staff who have a lot of manual work to do and a slow process for new patients.
And this problem is where automation comes in. Instead, patients are automatically registered in exactly the same way a staff member would do it, 24/7, 365. So now let's hear more about registrations before automation.
It was all manual, mainly manual, and this was a lot of administrative time and also errors and having to code things correctly. So all that was taking time, and we needed to reduce that time. One less task for our practices.
From a patient perspective, it was taking several weeks in some cases for them to actually register with a practice.
Bringing it down to the real nub of the matter, which is why do we even care about that? Well, because patients waiting for being registered at GP surgery means that they're not accessing healthcare. Instead, they're going to A&E. They're not getting their medications. And on the flip side, the GP surgery actually gets paid when that patient is registered. That's the main part of their income.
And so what are the core benefits of automating?
We have a constant pressure on registrations. So the fact that they are now, I would say 98% automated, just saves us an incredible amount of time.
By releasing time up amongst these GP practices, you're getting staff who are taking away from these repetitive, mundane tasks of registration, which is just typing in data to a computer, and instead they can be doing really fantastic healthcare work, such as chasing patients up for their diabetes checks, offering vaccinations, getting children vaccinated.
Clinical and staff teams, if I can protect them by reducing workload, which means that they don't go anywhere and they're happy, they then have much longer relationships with the patients because they haven't gone anywhere.
By giving people tools to do more with the resources that they have is, as far as I see it, the only way that we can survive in general practice. And just the patient experience, why do we all work for the NHS? We're trying to give patients a good experience. We're trying to give them excellent healthcare.
So by automating registrations, practices are increasing staff capacity, empowering productivity, all while patients could access healthcare faster than ever before.
And the results are outstanding.
We're at around 9,000 registrations a month just for South East London that are being automated. If you think about the time that's being saved for those patients, that's phenomenal. With implementation, I think we were fortunate enough that Lambeth had done a lot of the product development for us.
I think we were going for something like 17 coded data points from your manual registration to 85, which is a 500% increase. That's amazing, right?
When we offered it, initially started off with a few practices, and after the benefits were being seen, and by the time we came to the end of the pilot, 140 practices were now using automated registrations. Absolutely enjoyed it. I think 140 out of 193 was beyond what we expected. And so that was quite a nice thing to achieve, and also the real difference that it's made in terms of reducing workload and also improving patient experience.
I think we're really proud of that we've supported and worked with, is working with NHS England to actually be able to work with the supplier to also automate the national solution.
Since we turned on automatic registrations, we haven't really thought about it because it solved a problem for us. What this automation has done has taken a process that worked and actually made it work. That's a rarity in our day-to-day.
Could you manage without it?
No, no, I refuse to. I don't want to sound like a brown nose, but I don't really know what could have gone better.